Welcome to Conversations with Faith Leaders on Health. This series looks to be a tool specifically for faith leaders in any background looking to serve a variety of communities through either developing or sustaining an already established health ministry. I am your facilitator, Reverend Krista Forbes, and this series is hosted by Our Health Ministry and was developed in partnership with the Morehouse School of Medicine's National COVID-19 Resiliency Network. Our Health Ministry is where faith, technology, and community intersect to provide trusted information, tools, and connections that support faith-based organizations in their interest of pursuing health ministries. I will look to have a variety of conversations with faith leaders who serve a variety of denominations about their interests and/or involvement in health ministries. Today, I will be joined in conversation with Reverend Dr. Kathi Chavous of Atlanta, Georgia. Dr. Chavous serves as the bereavement coordinator with Trinity Hospice Care of Georgia, as well as serving as an associate minister with the Providence Missionary Baptist Church in Southwest Atlanta. Reverend Dr. Chavous combines her ministerial experience with 23 years of experience with the Erie County Health Department in Buffalo, New York. So, good afternoon, Dr. Chavous. How are you today?
I'm doing very well, Krista.
Wonderful.
Yes.
Well, I have definitely been looking forward to having this conversation with you. I so
Mhm.
appreciate and love the fact that you are able to build on your ministerial and this wonderful health background that
Yes.
you have.
hmm
So with that, I want to just jump right in there and think about viable health ministries. After serving in ministry yourself with churches and being in that space, what resources would you identify as being most beneficial to support the start of a health ministry?
Well, the first thing is to ensure that you have pastoral support.
Mm,
Uh, Following that, I would suggest developing a health team.
okay.
That team might consist of medical professionals, educators, healthcare personnel, or other representatives. You also want on your committee people who have an interest in promoting healthcare.
Yes.
That should also include lay people from the congregation. Once you've done that, then you have to ensure that you have a definitive direction.
Mhm.
Okay, know what you want to focus on and how you plan to do that. Are you going to use presentation format, put information on the church website, or share printed information? Will you do a needs assessment of your congregation to determine what may be going on in the midst of your church family? In our community, in the African American community, there are chronic health problems such as cardiovascular disease, hypertension, high cholesterol, and I'm sure I could name some more. But you have to decide, what approach are we going to take?
Mhm.
Are we just going to share information within our congregation? Are we going to partner with smaller churches who may not have the resources that your particular congregation may have?
Yeah, I love that idea of doing a needs assessment because you're right.
Mhm.
Are so many different things happening in our communities, and we can't
Right.
burn ourselves out. No church, no faith organization should try to be all in all to everybody, but really
Right.
focusing in on one or two needs of the community and/or the
hmm
congregation, depending on their direction, and then just
hmm
hone in on that. And then, of course, identifying with those resources that they do have. With that being said, and again, because there are so many things happening in and around a church, what would you say are the biggest challenges that a church could face in launching or sustaining a health ministry in these days and times?
Well, I think one of the challenges is helping the congregation,
Hmm.
ministerial team, everyone that's associated with the church to understand it's not an event. that it's an aspect of ministry.
Yes.
While you may do various things throughout the year, it still is a part of a ministry. We're called to minister to the whole person. And understanding that also means recognizing that we are, as a people, we are a complex, interwoven, complex community interwoven by many threads. Okay, one of which is the need for sustainable health care.
Oh, yeah.
And I think the thing that proved that to us is the way a lot of our communities responded to the need for the COVID vaccine.
Yeah.
Based on past misinformation, distrust, led itself to that. One of the things that we must definitely attempt to do is understanding that the congregation as a whole understands the effort as an aspect of ministry and not view it as an event, something to do in the midst of the summer or in the spring. In ministry, we're called to minister to the whole person. And that means recognizing that we are a complex community and we're woven together by many threads. Okay, one of which is the need for sustainable health care.
Yeah.
Okay, we can partner with the Red Cross. We can partner with other entities that may come to the church with their vans or trucks or whatever you want to call them. But you have to have something going on after that. If you only do that, it becomes an event and people will pass it by. The Black church, more often than not, has been the vital vehicle for life promotion. There is a study called Health People 2020 that states that we are 15.2% of the population of this country, and yet we have the poorest health status indicators in the nation. So once the leadership can convince or teach or enable the people to understand that it is an aspect of ministry and not an event, I think that will make a great difference.
Absolutely. Having that concept from the very beginning, making that as high, ranking that as important as the needs assessment. And I would say, even before understanding and making the needs assessment maybe drive after that, having that concept and say, what are we going to do to sustain this ministry? How are we going to do it? Because there are so many things that we have to address. And I appreciate you identifying the statistics there from that report. We've heard a lot about those statistics. We've heard a lot over the past 2 years because of the pandemic. We saw an increase, this surge, if you will, this urge in public awareness of inequities that people of color face in our health systems, and how these inequities were not only emphasized because of the disparities of those communities of color, but they were also showed the results of those inequities, the higher rates of COVID infections, the higher rates of hospitalizations and even deaths. When we think about all of those inequities and the disparities and the results of those systemic challenges, if you will, how do these known gaps in our healthcare system play out in one's decision to even start a health ministry?
Well, I think there's a need to recognize that the lack of seeking healthcare probably is a 2 or 3 pronged issue. One is physical accessibility. How do I get there? 2 is a fear-based response. During the initial push for COVID vaccine, a lot of people referred to the Tuskegee experiment.
Yeah.
So therefore, they did not trust. There were people who actually felt that things were being injected into their bodies so that they could be tracked wherever they go. There are a lot of reasons. The other, unfortunately, is a need for more sensitivity from physicians themselves.
Yeah.
When when a person comes in that's already nervous or afraid, or doesn't even have the same educational background that the physician might have, talking down to a person or appearing dismissive is not going to get a person to come back and want to take care of themselves. Okay, so we have a lack of trust and perhaps what you might call a lack of listening skills on the part of physicians.
Yeah. And I would even push that, with when you have those lacks that exist,
Mm-hmm.
this is an opportunity could be an opportunity for a health ministry to have real conversations
Mm-hmm.
within their congregations and to have, a and come to the altar moment where people just put down what they're afraid of. What are they afraid to know? What are
Mm-hmm.
their hesitancies? What are their challenges that they have, their own personal stories? And that opens up an opportunity again for health ministries to have the hard conversations, but to also begin to identify, okay, we need to do more education before we even explore doing a true health fair or having a
Mm-hmm.
conversation about
Mm-hmm.
this treatment or the other. So there's definitely some opportunities there. Well,
Yes, definitely. At Providence, we have a small health committee comprised of physicians who
oh,
are readily available. They have been really guiding the church through this period dealing with COVID and sharing the information in a way that people can understand and that they can readily embrace.
mm. And that is a perfect model,
Yes.
definitely
Mhm.
a perfect model. Well, I don't want to take up too much of your time because you and I could talk about this all day because it's just so great, a great information. So I want to thank you so much for your time and the wonderful, great insight that you provided with us today. Again, you shared some really good nuggets, some things for us to think more about in our
Mhm.
planning and in our one's pursuit
Mhm.
of a health ministry. So we really again appreciate this conversation with you and participating in our series for today. And I want to encourage you and invite
Mhm.
you and others who might be interested that if someone would like to learn more about developing or sustaining a health ministry, to please visit our health ministry. That website is www.ourhealthministry.com, and we will continue to have more information and more tools that will get updated regularly on the website. So again, thank you, Reverend Dr. Kathi Chavous of Georgia, and we want to thank you so much for participating, and thanks again to the Morehouse School of Medicine's National COVID-19 Resiliency Network. Thank you and have a wonderful day.